This area is called epitope on the antigen, epitope, and on the antibody is paratope. So between epitope and paratope, there are many chemical bonds, which all of them are not covalent. So the chemical bond between epitope and paratope are non-covalent non-covalent. For example, hydrogen, ionic, hydrophobic, and van der Waals. So each bond is weak, but many, I mean, here there are many bonds, many chemical bonds. So they will be strong. So they will be strong. Reaction between antigen and antibody is a reversible reaction. Is a reversible reaction, and the visible reaction occurs when the rate of binding of antigen to the antibody exceeds the rate of dissociation. It means that the rate of binding, the rate of antigen antibody complex should be more than antigen and antibody alone. Antigen and antibody dissociation. This one should be more. After that, we can see their reaction between antigen antibody as, for example, agglutination or precipitation, or and so on. So visible reaction occurs when the rate of binding exceeds or should be more than the rate of dissociation. And here we have constant equilibrium coefficient, constant, constant equilibrium coefficient, which is the concentration of immune complex or antigen antibody complex divided by the concentration of antigen multiplied by the concentration of antibody. So this is constant equilibrium coefficient of antigen antibody reaction, which is the concentration of immune complex or antigen antibody complex divided by the concentration of antigen multiplied by the concentration of antibody. So if we have a more antigen antibody complex in the reaction, the constant equilibrium will be more or less. Just answer with one word, please. The question is, if in the reaction there are more antigen antibody complex, so how about constant equilibrium? Is it more or less? Yes, good. Yes, Mr. Ahmad Ali, good. With the more antigen antibody complex, we have higher constant equilibrium between antigen and antibody. Uh, Now we want to explain the affinity and the avidity between antigen and antibody. What is affinity and what is avidity? What is affinity? Affinity is the tendency. In Persian is tamayul, but I'm not sure in the Arab how we can say tendency. The tendency in Persian is tamayul. So the tendency between epitope and paratope on the antibody is called affinity. Okay, affinity is the tendency between epitope and paratope. Epitope on the antigen and paratope on the antibody. Can see here that This is an antigen. This is an antigen with many epitope, which they are different. They are not same. You can see here this epitope and this epitope are different, and therefore we have different antibody against different epitope. For example, for this epitope, this is a specific antibody which can bind it, and for this one, this, and so on. So we have a specific antibody against epitopes on the antigen. Here, the total of tendency of antigen and antibody is called avidity. The overall strength between epitopes, different epitopes on the antigen and different antibody is called avidity. Therefore, the overall strength of binding between an antigen with many determinant means epitope, epitope, and multivalent antibody. Uh, this antibody here is bivalent antibody. Bivalent means that it has two valency to bind to epitope. This is one binding, and this is two valence which already bound to two epitope. So here the equilibrium constant will be 10 power 4, and here the uh, k equilibrium will be 10 power 6, and this is called avidity, not affinity. If just one epitope and one paratope, it is affinity. More than one, even two or more, will be avidity. So, do you know which antibody is this? Which antibody? This one. Which class of antibody? You can see here. This one. How many subunit it has? This is monomer antibody. Monomer. It means that it is just one subunit, one monomer. It is maybe IgG, this one. But how about this? How many subunit it has? 1, 2, 3, 4, 5. It has 5 subunits. So what is it? Which type of antibody is it? Ig. Yes, it is IgM. It is IgM with 5 subunits. 1, 2, 3, 4, 5. It means that it is pentamer. It is pentamer. But this one is monomer, like IgM, monomer, like IgG, like IgG. So this one is monomer, for example, IgG, but this one is pentamer, it is IgM. IgM. Any question? What is sensitivity and specificity? Sensitivity is the ability of tests to detect even very minute quantity of antigen or antibody, very low amount. Sensitivity means the ability of detect very minute amount or very low amount of antigen or antibody. When the test has high sensitivity, it means that false negative results may be absent or minimal. So false negative result may be absent. We don't have false negative result. We don't have false negative result, or maybe it is minimal. It is in the lower level false negative result when we have a test with high sensitivity, when we use a test with high sensitivity. And how about a specificity? A specificity is the ability of test to detect reactions between homologous antigen and antibody only, and with no other. It means that if two antigen is the same, partially same, I mean they are some epitope, they have some epitopes which maybe are similar together. So maybe the test can detect both of them, and it is called false positive result. Kezb, I think in Persian is kazib. I'm not sure in Arab. In Arab, how we can say false in same kez. Yes, correct. Kez. So the test with the high specificity, uh, in the test with high specificity, false positive reaction or false positive result are absent or minimal, minimal. So we must use the test with high sensitivity and high specificity. High sensitivity and high specificity. Any question? In the reaction between antigen and antibody, we have three steps. The first step is sensitization, and then lattice formation, and the tertiary phenomenon, which is detected by effect on tissue or cells. So we are going to explain this phenomenon one by one. We are going to explain them. In the primary phenomenon, which is sensitization, binding of antigen and antibody is not visible. Like this. Please consider that here antibody bind to the antigen on the, for example, red blood cell. Okay, on the red blood cell. Antibody bind to the antigen, but they are not aggregate together. So we cannot see it. It's not visible. We cannot see it by our eyes. Okay, it is not visible. So for the test which antigen antibody complex couldn't aggregate together, we have to use label. For example, radioactive, fluorescent, or chemiluminescence, or enzyme. And they are competitive or non-competitive. Competitive or non-competitive tests. Some tests which are categorized in primary phenomenon is radioamino assay or RIA, and enzyme linked immunosorbent assay, or EIA or ELISA, which in this test, in this type of test, we don't have lattice formation. We don't have lattice formation. Antigen and antibody complex or immune complex are not aggregated together. So the reaction is not visible. The reaction is not visible. This picture is a competitive RIA. Competitive RIA. So how it is performed? The competitive RIA in the in a phase or in a step before test, we have to determine amount of antibody needed to bind to a known amount of labeled antigen. So labeled antigen, what is the meaning of labeled antigen? Labeled antigen means that antigen is labeled with radioactive antigen which already labeled by radioactive. In this step, in this phase, we have to determine the amount of antibody and labeled antigen to have product. What is the product in this reaction? The product is immune complex. The product is immune mahsul. Mahsul in Persian. I think in Arab also. Product. Mahsul. Hasil. So here we have antigen antibody complex. And then in the test, we want to know whether in the patient sample there are antigen or not. We want to determine the presence of antigen in the patient sample. So in this reaction, we have antibody specific for this antigen, and also labeled antigen which is labeled by radioactive, and also patient sample together. They will incubate together. And then after incubation time, here we we detect the we detect the amount of radioactive, how much radioactive we have here compared to the radioactive here, you know. And please consider that after incubation time, we have only the radioactive which already bind to the antibody, because the free radioactive antigen, labeled antigen, are eliminated by washing, you know. So this labeled antigen already eliminated by washing, and here we have only immune complex. So the question is, what is the relation between the amount of radioactive here, and the amount of antigen in the patient sample? Do you think that more radioactive here related to the or proportional to the more antigen in patient sample, or less? More or less? I mean that they are reverse or direct. The relation is reverse or direct. What do you think? Direct? Please think more. Here, the radioactive which we can detect in the immune complex and antigen in the patient sample, the relation is direct or reverse? Please consider that here labeled antigen and patient sample antigen have a competition. In Persian مسابقه. In Arab قياس. What how we can say competition, قياس, or something like this. I'm not sure in Arab. So here they have come, yes, true. Okay, thank you. So here antigen in patient sample and labeled antigen have a competition. So here more labeled antigen or more radioactive means less antigen in patient sample. So they are reverse. So they have a reverse relation, reverse, not direct. Understand? But here in non-competitive RIA, what happened in non-competitive RIA? In the first step, we have to immobilize antigen on the solid phase. Immobilize means no تحرك ثابت ساكن, no not moving. So antigen is immobilized on the solid phase, and then we add patient sample. If in the patient sample, if there is antibody, a specific antibody for antigen, so antibody bind to the antigen. Here we have immune complex. After that, we add labeled anti-immunoglobulin. Anti-immunoglobulin means immunoglobulin which can detect antibody, human antibody. Okay, consider please here this one antibody, blue antibody, which is secondary antibody. This is secondary antibody, the blue one. Okay, can detect the first or primary antibody, which is attached to the antigen, and then this one is labeled by radioactive. So um, more radioactive detected here means more antigen antibody complex. So amount of labeled antibody bound is proportional to amount of antibody in the sample. It means that they have direct relation. So more radioactive here means more immune complex and more antibody in the patient sample. Any question? The RAS test. The RAS test is a test which used for detection of the specific IgE antibody, to a suspected or known allergen. So RAS test or radioimmunoassay test is performed to detect a specific IgE against an allergen, against a known allergen. And this test also is a radioimmunoassay test to detect total IgE. So RAS for a specific IgE against a known allergen, but RIST is performed to detect the total IgE antibody in the serum of the patient. Here you can understand the RAST mechanism by a schematic picture. This is allergen or non-antigen, which is allergen, and then add the patient sample serum from patient here. If there is IgE, so IgE bind to the antigen, to the allergen, and then after washing, we can find antigen antibody complex by secondary antibody. This is secondary antibody which is labeled with radioactive. Is labeled with radioactive. So here more radioactive means more antigen antibody complex. Any question? Any question? No. Okay. We will continue our subject about antigen antibody reaction next week by ELISA. If you want to study before the class, so next week we want to talk about ELISA and immunofluorescence and the secondary phenomenon, which is contained agglutination, precipitation, and so on. So if you want to study before the class, to be ready for class, you can study ELISA, immunofluorescence, and also secondary phenomenon, which is contained agglutination, precipitation, and so on for the next week. If you have any question, please write it or please activate your microphone if you want to speak. Any question? No? Okay. Next you, yes, Mr. Ahmed Ali. I told you in the first class, if you remember, I told you about the references, isn't it? Everybody remember? This is Zahra. Do you remember? I told you about the references, about the book which you can study. Okay, I repeat it again. The molecular and cellular immunology of Abul Abbas, molecular and cellular immunology of Abul Abbas, and immunology of Royd, and Janvey or Kobe, no different. If you can prepare ebook, electronic book, it's better. If you can download the book from internet, or if you can buy ebook, it's better. It's better to have ebook, I think, because maybe some of the book is expensive to buy, but ebook is not expensive, and you can download or buy them easy. So I suggest you to prepare ebook. Okay. So immunology of Abul Abbas, Royd, Janvey, Reach, Kobe, all you can use, but just one also is enough. It's not just one or two enough for you to study. One book or two book, it's related to the, it's up to you, up to you. One book, two book or more, it's up to you. How much you like to study, how much. So it's up to you. Thank you. Any question? Any question? Okay. See you next